Hi, my name is Lazaro, and I wanted to share my experience that I had recently with a septoplasty and turbinate reduction surgery. The reason I want to share my experience is before my surgery, I went onto YouTube to get a sense of what other people went through, and I prepared myself for a pretty horrific experience. And now that I'm 48 hours in, I'm happy to let you all know it's not really that bad, and if you've been considering it, you should go see your doctor and see if you're a candidate. And with the right doctor and the right treatment, you could be in and out of there pretty quickly. So my surgery was a little different than what many people have gone through. Some of the stories I heard had to do with splints, tubes, and a lot of packing in the nose area. Thankfully, the doctors at Swedish Ballard in Seattle didn't use that procedure, so I didn't have to do any packing or any stents or tubes. This is me 48 hours in. I went in at 8 o'clock in the morning. It's now about noon, 48 hours later. As you can see, there's not a lot of swelling. The pain is minimal. I'm congested. It feels pretty much like a bad head cold. My nose is stuffy, my ears are a bit clogged, but the pain is totally manageable. The first day was, again, not as bad as I thought. Procedure lasted about an hour from when I went under to when I woke up. The doctors at Swedish were great. The nurses took really good care of me. They explained everything going out, and I went out feeling prepared. I slept right away as soon as I got home. I was able to sit up and sleep reasonably well. Woke up with a little pain, took my medicine. But overall, just been resting, hydrating, taking my medicine, and I'm happy to report it hasn't really been that bad at all. I could breathe now. Again, you can hear the congestion. Of course, you don't want to blow. You don't want to breathe in too strongly. You definitely don't want to go in there picking your nose. Just want to let it heal and recover. So again, if you've been considering it, go see your doctor. This is only 2 days in, and I'm feeling a lot better. The other thing I want to do today is share a couple of tips and tricks just to help you make your recovery a little bit better. The first of which is definitely stay hydrated. They tell you that at the hospital, and I'll tell you that now. It makes a world of difference. Take your medicine, keep on time, whether it's a 2-hour, 4-hour, 6-hour. There's no need to really question that. So follow your pain medication as your doctor suggests. Get a lot of rest. Start slowly when you eat. Depending on how you respond to the anesthesia, you may get nauseous at first. I didn't feel anything. I was able to eat crackers and soup right away. Worked my way up to some mashed potatoes. Now 48 hours in, I've had eggs and bread and ham for breakfast. My appetite came back. Beyond that, I'm feeling a little tired, a little bit weak, a little bit dizzy. I think that's more from the medication than anything else. But I have to say the worst part of this is just, the head cold, congestion, and this urge to just blow your nose, which you've got to fight. This urge to just kind of clear that congestion out. And again, you can hear the air is going through, but I am definitely congested. So I'm going to share a couple more tips and tricks with you that just kind of made the recovery a lot better. And again, I'm 2 days in, but each day is feeling better than the last. So the next thing I'm going to talk to you about is a little bit of a trick for sleeping. So I'll show you that next. So what you're seeing here is basically my nighttime routine. Picked up a box of standard 4x4 gauze pads, about a 1-inch medical tape, and when you open up the gauze pads, you'll have roughly 4 squares. What I've been doing is cutting them into a single square, stretching out a piece of tape that's roughly the width of my face. And then what I've been doing is very simply sticking the gauze to the tape. And it's going to be tricky because I've got one hand here, but basically wrapping it around so that you end up with something like this, so that you have the gauze on both sides. So this next part is a bit counterintuitive. You might be inclined to put the gauze under your nose like that, but that actually restricts the air. And my doctor was pretty specific not to block that the healing is better when you leave it open, especially with my procedure, which didn't come with packing or any kind of splints. So what I've been doing instead, after wrapping it like I showed you, is simply make a bit of a mustache, keeping it right under my nose, tucking it in just a bit, just like that. This made sleeping really easy because ultimately you will drip a bit at night, especially as you change position. But this way you don't have to worry about it too much, whether it's coming out the outside or on the inside, you're covered. There's no pressure. And of course, you can always choose to cut it a little thinner if it bothers you over your lip like this. But then if you wake up in the middle of the night and you need to take it off, it's not blocking your nose. You're not restricting your airway at all. And again, all you want to do is just wrap it around the tape. Something else I found really helpful is Ocean saline spray, and they'll tell you to take this from the hospital. This is basically to help keep things irrigated, stop things from crusting up and getting too uncomfortable, getting the pressure not to build up too much. I found that at first it was a bit hard to get this to stay, so if you tilt your head to the side, that way it's a little bit more comfortable and helps the fluid stay in there. 48 hours in, I'm having no trouble, and I'm using it like regular nasal spray, and it helps keep everything lubricated and much more comfortable. Something else that's been really helpful is just keeping the ice on as much as possible. They gave me this great mask coming out of the hospital. You can just fill it up at the top with some ice. I've been doing 20 minutes on, 20 minutes off as much as I can. It definitely makes a difference. Drinking cool fluids keeps you comfortable on the inside. Putting this on the outside keeps that inflammation down. Makes a huge difference. Ice is your friend, so use that as much as possible. And then maybe the obvious last tip is just have a lot of tissue on hand. You're definitely going to be dripping. A lot of it might just be the saline. First day you're going to have some blood, quite a bit of blood. But for me it cleared up pretty quickly. About, by late evening, the night of the operation, it was totally manageable. Within 4 or 5 hours of getting home, I was able to remove any kind of bandaging like I showed you before, and I've just been using tissues ever since. So I'll report back in a couple of days and let you know how it's healing. But overall, I'm 2 days in and I'm really happy to have done this operation. I'm hoping the next couple of days goes as well as these first two. And again, if you're considering it, check your doctor, check with your doctor. And if you're a candidate, it's a great option for you.